Osteoporosis, a condition in which bones become less dense and weaker, affects millions of older American women and men.
The loss of bone strength can increase the risk of fractures, pain, and disability. In the elderly, osteoporosis fractures can even be life-threatening.
On today's Health Talk, we'll discuss the risk factors for osteoporosis and what you can do to keep your bones strong and healthy.
So please join us. We're up next.
Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Today we're going to talk about osteoporosis. It's a serious bone condition which is both preventable and treatable.
Joining us is Dr. Robert Altbaum. Bob is a senior internist with the Western Connecticut Medical Group. Over the course of his many years in primary care, Bob has treated hundreds of patients at risk for and with osteoporosis.
Welcome back to Health Talk, Bob. Great to have you here.
Happy to be here.
So maybe you can start our viewers off by explaining a little bit about what is osteoporosis?
Well, osteoporosis has a definition, but basically it's when the bone has less bone mass, it becomes less dense, and actually the architecture, just the microscopic changes in the bone as well, the end result is it becomes increasingly fragile and leads to fracture. So the most important thing is it's bone that isn't as dense as it used to be and has a greater risk of fracture, which is the end result and the major problem with osteoporosis.
And that's interesting because I think people don't think of bone as a living part of our body. They think, you got bone, it's sort of like rock, it's there. So how does bone...
Bone is living tissue, and it undergoes constant what's called remodeling or change. There are little cells called osteoclasts that chew it up, and there are cells, osteoblasts, that relay down. So it's like a bricklayer that's constantly fixing the building. It's constantly responding to the stresses of your body's change. In fact, every 10 years, the entire skeleton is new, which I think is, people think of people as a kind of an erector set. It's just static, and it's not. It's constantly changing. That gives both good and bad. You can, if the chewing up, the cells that are removing tissue and bone outweigh or overwhelm the cells that are laying it down, the bone mass goes down. And eventually that can reach a critical level where you can actually fracture.
And losing bone mass is really part of aging for women and men, isn't it?
Yeah, I mean, there are lots of things that really kind of contribute to osteoporosis. There are some that are modifiable and some that are fixed. For instance, age it's an inevitability. Your greatest bone mass is when you're about 30. And at 30 years old, you have
really
peak bone
peak
mass.
at 30, don't you? Your mind peaks at 30, your athletic ability.
And other things.
And it's downhill from there.
But it's a decline. Women, unfortunately, when they reach the menopause and they lose their hormones, they actually decline a little faster for a few years, which is why it seems to be more common that they get osteoporosis. Plus, they don't have as high a peak to begin with. So there's a natural factor of aging with decline. But there are a lot of other things, that some of which you can't control, like your age, your gender, as I said, women. Racially, Caucasians and Asians have a greater risk of osteoporosis than African Americans, which is, again, just nature. Your family history. If mom or dad had osteoporosis or fractured a hip, that puts you at greater risk. You can't change that. But those are the non-modifiable factors that put you at risk. And there are a lot of things you can do to minimize your risk.
I would think knowing your non-modifiable factor should influence how aggressively you pursue some of the modifiable factors.
Absolutely. And it also influences sometimes when you're going to test people, when you're going to actually do screening for that. The modifiable factors that are common, there are a lot of diseases that can be associated with osteoporosis, but the everyday factors, things like smoking, I haven't found anything that smoking is good for, but smoking also hurts osteoporosis. It kills the cells that lay down the bone. So smoking, drinking, partly by affecting bone mass and also by increasing falling, being sedentary. Activity sends signals to the body that you need good bone, and the body actually is able to remodel the bone and make it stronger. And good nutrition. To some degree, everybody needs calcium and vitamin D because those are the kind of the building blocks of bone. And having an adequate amount of calcium and vitamin D contributes. You can be active. You can take your vitamin D. You can avoid cigarette smoking. You can avoid alcohol in excess. And the end result is you can at least improve the things that's under your control.
Maybe you could talk a little bit more about what kinds of activity are best for bones, because you really need some weight bearing to give those signals to the bones.
There's a difference, or not a disconnect, but a difference between what's good cardiovascularly and what's good for bone. Swimming is a great cardiovascular exercise. Biking is a great cardiovascular exercise. But when you think about it, when you're swimming, you're buoyant. you have no weight. I mean, that's one of the reasons it feels good on your back. And well, that doesn't really help bone because the bone isn't getting the weight signal, the stress signal to remodel.
When they send up astronauts up into space and they've been there for a month, they lose considerable amount of their bone
That's right, and they're
mass.
doing a lot of activity. They're
Right.
constantly in
Right.
motion. So swimming and biking, which I would never say are bad, they're wonderful cardiovascular fitness activities, don't help bone. But walking helps, running helps, to some degree working on the elliptical helps. You could put a backpack on or use heavy hands and just add a little weight. And again, the bone gets the signal of the weight and the activity, and then it starts to remodel and strengthen.
It's very interesting as someone who's interested in engineering. You know, the weight on the bone actually creates certain electrical signals in the bone itself that says we need to get stronger. It's sort of the use it or lose it.
We don't quite fully understand it, but that's true. There are electrical kind of charges, and then they send out chemicals, and then the chemicals revitalize the bone production.
So that doesn't mean one should be obese, though, because that puts
Well, you
extra
don't want
stress
to
on
be
your bone.
obese, and you don't want to be too thin. You know, there's a rule you can't be too thin. In osteoporosis, actually, one of the risk factors for fracture is having a thing called a BMI, which is just a term we use for weight. If your BMI is below 20, which is very thin, you actually have a greater risk of fracture. So being too thin is actually a risk factor. You want to be healthy weight. You don't want to be obese, but you certainly don't want to be too thin. Obesity actually does send weight signals to the bone that strengthens bone, but there are a lot of other reasons
Right,
not to be
gives you
obese.
Maybe with that you could talk a little bit about a healthy diet in terms of preventing osteoporosis.
Well, again, the most important thing in osteoporosis is really you want an adequate diet, but you want an adequate amount of vitamin D, and vitamin D is a sunshine vitamin, so theoretically you could get it just going out in the sun for 20, 30 minutes a day, but they did a very big study in Boston, and 50% of the people in Boston were vitamin D deficient during the winter. The same people might have had a very good vitamin D during the summer, so you need some kind of supplemental vitamin D. It's in milk, it's in a variety of foods, but the best way to get your vitamin D, actually, I think, is to take a supplement. And there are different organizations that have different recommendations, but a simple rule of thumb is 1,000 units, and that, again, that may not...
How about milk and dairy products? You know, they build strong bones. That's what we were brought up.
Dairy calcium is probably good for bone. You certainly need some degree of calcium. How much calcium is always debated. Again, a rule of thumb is about 1,000 milligrams of calcium a day. Now, if you're doing it, a helping of cottage cheese, a scoop of ice cream, a glass of milk, they all have about 250 milligrams, and you want to get to 1,000 milligrams a day. So you could have 4 helpings of that. That would be an adequate amount of calcium. Adults don't often eat that much dairy. They just
and a lot of adults have lactose problems.
That's right. So they can take calcium, and the two most common calciums is calcium carbonate and calcium citrate. Calcium citrate's a little easier on the stomach. It doesn't matter whether you take it with food or without food. So if I had a preference, I'd rather get those 1,000 milligrams of calcium citrate rather than calcium carbonate. And I would actually take 500 milligrams and 500 because the body, if you take 1,000 all at once, you basically can't absorb it all. So you're better off just dividing it.
What about foods or drinks to avoid for
Well,
bone
I mean,
health? We
again,
hear about
there's some things like soda and certain phosphorus compounds.
Carbonic acid in fizzy soda.
Right. Well, theoretically, what's happening is the bone you're acidifying the body a little bit, and that kind of leaches bone calcium carbonate as a buffer, so it's coming out of the bone. That happens to some degree. It's not a critical player. It's there are, again, a lot of reasons maybe not to have lots of soda. But in moderation, I would never say it's a bad thing to do. People who are good for their gallon of Coke a day,
so supplements are really the best way.
I think supplements
are
the easiest way.
Men and women should both be taking
Yeah,
supplements?
men the recommendations are lower. And again, it's 1,000 milligrams a day, so a lot of people reach it through their diet. But if you took 500 milligrams of calcium and then you had 2 helpings of dairy, that would be useful. Men over the age of 70 also get osteoporosis more commonly.
Yeah, you should probably say that because people don't think of osteoporosis and men in the same breath.
That's right.
Even doctors don't.
That's right. And again, there are a lot of specific diseases that men can get that can be linked to osteoporosis. But also, as we age, we don't have that dramatic decrease in bone density that women might have at menopause, but we are losing, our testosterones drop slowly, and so do our bone density. So men do get osteoporosis. And at about 70, fractures can begin to happen, although in a lifetime, a woman has a 40 to 50% chance in her life of having a lifetime-related osteoporotic fracture, whether it's her spine, her hip, or her wrist.
That's a big number.
High number. Men, 20%. So it's significantly less, but
really-
it's still 1 out of
But
every
I've,
5.
I've heard it said that
is a real
any
number.
older man who has a fracture should have a bone density study.
Absolutely, that's definitely correct. A man who fractures, something's wrong.
And with that, maybe we can talk a little bit about diagnosis and screening.
Yeah.
Sure.
So when
well,
do you screen? When do you screen the
When do I
average
screen?
woman?
I'm a pretty aggressive screener. I mean, the recommendations, again, vary from organization to organization, but most of them agree age 65 and older women should be screened at least once, and then there are different guidelines on how to screen, how frequently to screen. A lot of people feel postmenopausally. Women with 1 or 2 risk factors should also be screened. Again, we talked about the being too thin, Caucasian, family history, smoking, drinking, a lot of risk factors. You say, oh, this person's really at risk. You should at least screen them and see where they stand in the spectrum of osteoporosis.
What does the screening entail for our viewers?
Well, there are lots of different screenings. I have a preference for a thing called a bone density, or DEXA, which stands for dual energy X-ray absorptometry.
impressed.
That was good.
DEXA's a
Yeah,
lot
that's impressed.
DEXA's a lot easier to say. But what it is it screens your spine, the axial skeleton, and it screens your hips, and sometimes your wrists as well. And basically, it's looking for bone density. The amount of X-ray that goes through the bone depends on the density. The more dense it is, the less X-ray goes through, and the computer can tell us how dense your bones are. If you go to a health fair, you'll often see an ultrasound
I was
of the
going to
heel.
ask about that.
Ultrasounds of the heel are actually not bad as a screen. They do correlate. The problem is they don't correlate as well with fracture risk as the DEXA does. And the other thing is it's very hard to use a ultrasound to follow your response to therapy. They're just not that precise. So if you had one to choose, I would choose the DEXA.
And if you, well, should ask you, when do you start to treat? If you see someone who has the osteopenia, which means decreased bone, or when they have full-blown osteoporosis?
Well, again, not to get to the guidelines, but
Yeah.
there's 3 grades. There's normal, then there's less dense but not critical, called osteopenia, and there's osteoporosis. The guidelines, you actually kind of agree on this, which is surprising in guidelines. They all recommend treating people who meet criteria for true osteoporosis. Their fracture risk is quite high. There's also some guidelines that say that based on osteopenia, which is the middle ground, there's a calculation you can do. It was actually done, it's called the FRAX, which is a cute little name for fracture, but it's a FRAX calculation, and you can tell a person their predicted risk over 10 years. And the guideline says if their risk of fracturing any bone is greater than 20% in 10 years, or their risk of fracturing their hip is greater than 3% in 10 years, it's cost effective and risk benefit positive to treat them.
And we should point out, we've run out of time, but there are some very effective medicines out now
There's
to
things
treat
things you can do, and wonderful medications
So
as
they're
well.
beyond the vitamin D and calcium. So they're
You'll have
real.
me, you'll have me
We'll
back.
have
I'll
you
talk
back,
about it.
exactly
Yeah, so
what
we-
I was going to say, and talk more about the
Unfortunately, our
treatment.
time is up. We want to thank Dr. Robert Altbaum for joining us today.
And thank you for watching. Please remember to send us your questions and comments at healthtalk@wchn.org.
And keep your bones healthy and strong.
Be well.